Get ready, India. The vaccine is coming. In about a week from now, India will undertake the biggest COVID vaccination program in the world as it begins administering shots to 30 crore people. A dry run will be conducted in all districts across the country on the 8th of January. How will you get the vaccine and how will the shots be administered? Milan Sharma with the details.
India's wait for coronavirus vaccine is finally over. In less than a week, rollout is set to begin. The plan is to inoculate 30 crore people, including healthcare and frontline workers and senior citizens in the first phase. India will be undertaking the biggest vaccination drive in the world, and the government says that the infrastructure is in place.
जिस भी दिन हम चाहेंगे EUA के 10 दिन के भीतर हम उसको EUA का अर्थ है इमरजेंसी यूज ऑथराइजेशन, तो जिस भी दिन हुआ, जैसे अब आप जानते हैं कि किस दिन हुआ, उस दिन से 10 दिन के भीतर में ये रोल आउट होने की पूरी तैयारी है.
So how will the COVID shots reach you? Covishield manufacturer Serum Institute of India and Covaxin manufacturer Bharat Biotech Limited will send vaccines from their facilities in Pune and Hyderabad by air. The vaccines will be sent to government medical store depots in Karnal, Mumbai, Chennai and Kolkata. They will then be transported through insulated or refrigerated vans to 37 state stores and 29,000 cold chain points. From here, the vaccines will be sent to all districts and primary healthcare centers.
हमने पंजाब लिया था, आंध्रा लिया था, ईस्ट में आसाम और वेस्ट में गुजरात, इनके 7 जिलों में हमने इसका एक ड्राई रन किया, जिसमें कि हर जिले में 5 सेशन साइट्स और हर साइट में 25 वैक्सीनेशन विदाउट द वैक्सीन ऑब्वियसली ये टेस्ट किए गए. इसमें कोई बड़ा इशू नहीं सामने आया.
What will be another shot in the arm for India is that the entire process will be carried out digitally. Registration for COVID vaccination will be done on CoWIN app. A unique health ID will be generated for beneficiaries. Healthcare and frontline workers, however, will not need to self-register. Sessions for vaccinations will be allocated with date and time digitally. Each session will be for 100 to 200 people.
CoWIN हमने बनाया भारत में है, लेकिन ये विश्व के लिए है. ये एक पब्लिक हेल्थ गुड है. तो जो देश भी इसको इस्तेमाल करना चाहेंगे, भारत सरकार प्रोएक्टिवली उनकी मदद करेगी इसके उपयोग में. इसमें सेशन एलोकेशन हो सकता है, आधार ऑथेंटिकेशन हो सकता है और इसमें यूनिक हेल्थ आईडी का क्रिएशन हो सकता है. AEFI की रिपोर्टिंग हो सकती है. 12 भाषाओं में ये आपके फ़ोन पर SMS भेजने की सुविधा रखता है. QR कोड आधारित वैक्सीनेशन सर्टिफिकेट ये जनरेट करेगा.
Health Ministry sources indicate that vaccination is expected to start by 13th or 14th January, but the final call will be taken by the centre.
It's the final countdown as India readies for its vaccination drive. The logistics are in place and nationwide dry runs have also been done. The 2 vaccines, Covishield as well as Covaxin, have been given an emergency use approval. All eyes on the dates and its announcement shortly as India readies to fight against the pandemic of coronavirus. With Sanjeev Kumar, this is Milan Sharma for India Today.
There's been a storm raging over Bharat Biotech's Covaxin being granted approval despite not providing phase 3 efficacy data. Well, India Today has now accessed details of the meetings of the Central Drug Standard Control Organization, the regulator that recommended approval for the shot. How was it that from asking for more data from Bharat Biotech, the SEC went into giving the green light to Covaxin? Well, here's the answer to that question.
Gearing up for the rollout, one of the world's largest COVID immunization programs set to kickstart. 2 contenders approved for restricted emergency use. AstraZeneca and Oxford University's Covishield, produced by the Serum Institute of India, and the homegrown Covaxin of Bharat Biotech.
दुनिया का सबसे बड़ा टीकाकरण अभियान चलाने के लिए भारत की तैयारियां जोरों पर है.
But some experts have raised concern over the approval of the indigenously made Covaxin. They find the go-ahead premature because Bharat Biotech has yet to produce efficacy data from Covaxin trials.
We're really talking about now is vaccines, and they're biologics, and they're actually going to be rolled out in healthy individuals on unprecedented scale. So there are some differences, and there is a need for adequate data on safety and efficacy before rollout.
India today accessed the records of meetings the regulator, Central Drug Standard Control Organization, held between December 30th and January 2nd.
The minutes of the meeting held by the subject expert committee under the Central Drug Standard Control Organization clearly shows that the subject panel changed its stance for approvals for Bharat Biotech's Covaxin because of the UK mutant strain that had entered India. In fact, the SEC said that initial data from Covaxin generated enough immune response, but the vaccine also had the potential to target UK's coronavirus mutant strain.
Composed of experts from varying medical disciplines, the SEC of the regulatory authority met on December 30th and January 1 and asked Bharat Biotech to expedite recruiting volunteers and furnish interim efficacy data. But when Bharat Biotech presented updated records, the committee granted permission for emergency use as part of clinical trials, especially as an additional option for vaccination in case of infection by the mutated strain. Bharat Biotech has stoutly defended its vaccine-making process. The drug maker is close to completing the final stage trials on 26,000 volunteers.
In pandemic situation with high mortality, available science and a lack of definitive treatments are considered by SEC for accelerated approval, as the Health Secretary has said. That is in our legal provision. In a pandemic situation, restricted use is considered based on safety and immunogenicity data, while phase 3 is still ongoing. Immunogenicity data generated through phase 2 clinical trial serves as a surrogate for efficacy.
Over to the rollout for 30 crore adults to be vaccinated in the first phase starting this month. With Milan Sharma, Bureau Report, India Today.
Bharat Biotech's Covaxin may be at the center of the controversy over its efficacy data, but it faced a big challenge in getting volunteers for its phase 3 trials. The makers of Covaxin are conducting phase 3 trials on nearly 26,000 volunteers now. Could this setback have been handled by creating more awareness about volunteering like America did?
In the middle of a raging pandemic,
Someone who works in the medical field, I feel like there's more that I can do to help those who can't help themselves.
I'm a flight attendant with American Airlines.
I work at a grocery store and I want people to safely get their food.
We need to register 1 million more volunteers to complete the studies and possibly get a safe and effective vaccine to hundreds of millions of Americans.
I would like to see again visible smiles.
I'm a grandmother of 4 and I miss my grandson. What can I say?
that is how Americans generated awareness about the fight ahead. Finding enough volunteers for vaccine trials. A momentous challenge in a country as diverse as India. Phase 3 trials for Bharat Biotech's Covaxin are underway at this facility in Jaipur. So far, 3,000 participants have taken the shot here since December 18th, including India Today's Sharat Kumar.
भारत बायोटेक कंपनी ने ये जो फेज 3 ट्रायल यहाँ पे इस सेंटर पे हमने स्टार्ट करें, पूरे राजस्थान में एक ही सेंटर है जहाँ पे हमने स्टार्ट किया इसको. इसके अंदर हमको कोई भी पेशेंट को सेलेक्ट करना होता है, पहले उसका इंक्लूजन क्राइटेरिया के अकॉर्डिंग मैच करना होता है उसको. तो इफ द सब्जेक्ट इज एलिजिबल देन वी इंक्लूड द सब्जेक्ट. फर्स्ट वी एक्सप्लेन द कंसेंट फॉर्म टू देंगे। तो जैसे मैंने आपको बताया इसमें 2 डोज लगेंगी, आपको फर्स्ट डोज लगेगी, सेकंड डोज 28 डेज पे लगेगी। इसमें 0.5 ml का एक जो सॉल्यूशन होगा वो इंट्रामस्कुलर लगाएंगे आपके हम, साथ में पूरा आपको ऑब्जर्व करेंगे। इसके अंदर हम आपको कोई भी अगर साइड इफेक्ट्स होते हैं, कोई मेजर साइड इफेक्ट, माइनर साइड इफेक्ट, एडवर्स इवेंट्स जिसे हम बोलते हैं, तो कुछ भी होता है आपको हमसे टच में रहना है, हम आपको टच में रहेंगे।
Amongst the 8 vaccine candidates in India, the indigenously made Covaxin has been granted emergency use authorization. Along with Covishield, developed by AstraZeneca with Oxford University, several others, including Sputnik and Zydus Cadila jabs, are due to begin their phase 3 trials. The Bharat Biotech shots, for instance, is close to completing the final stage tests on 26,000 subjects. But the hiccups it encountered initially suggest volunteer registry is a formidable task. Awareness issues and general reluctance in participating in the inoculation trials made the job difficult.
मुझे पता लगा कि जो है फेज 3 ट्रायल के लिए, कोवैक्सिन के फेज 3 ट्रायल के लिए वॉलंटियर्स की कमी पड़ रही है, तो मैंने डिसाइड किया कि चलो मैं भी इसका हिस्सा बनता हूँ।
Drug makers like Dr. Krishna Ella of Bharat Biotech insist negative narratives about their Made in India vaccine pose another challenge.
Many people just talking about gossiping everything in a different direction to just backlash on the Indian companies. That is not right for us. We don't deserve that. TV channels now, they talk about everything what they want to. And everything they throw mud into TV. And now, we are now waiting to clean up all our courts now. It's a sad part. There's no backup in this world anywhere.
It usually takes years to develop vaccines against infectious diseases. But researchers use the latest technology, artificial intelligence, to complete 3 major stages of vaccine development in record time. With Milan Sharma, Bureau Report, India Today.
Well, after Covaxin, Bharat Biotech is now betting big on the intranasal COVID vaccine. Bharat Biotech is working on 2 nasal vaccines with US-based universities. It claims that the nasal vaccine will be easier to administer and more effective. Take a look.
Bharat Biotech India Limited is now betting big on its intranasal COVID vaccine. Bharat Biotech is working on 2 intranasal vaccines with the University of Washington School of Medicine at St. Louis, and another with the USA-based vaccine maker Flugen and virologists from the University of Wisconsin and Madison.
Even Nature publication clearly said in Chad vaccine that we are not promising whether 1 or 2 dose vaccine will not prevent infection, not transmission. That means it will still transmit the virus. If we want to stop the transmission, nasal is the only route.
Bharat Biotech India Limited founder claims that the nasal vaccine will be non-invasive and easier to administer, and that it will offer faster, stronger and longer immunity against coronavirus.
Covaxin is a simple 2-dose. We are the only vaccine above 12 years age right now. We are planning to do even children's trial also soon. Nasal vaccine, we are expecting to enter into clinical trial soon. Nasal is the only one will prevent the infection and transmission. Please keep in mind the word, we underline this word.
What's more, it can also be given to children.
Nasal will protect the mucosal immunity. The IgA response will knock off the entire virus as soon as it enters. As soon as it enters, it knocks off, you stop the transmission.
Experts say the intranasal vaccine, if successful, could play a major role in stopping transmission of the virus and lead to eradication of the disease from the globe. Will the nasal vaccine be the real game changer in the fight against COVID? Bureau Report, India Today.
While India is now registering fewer active COVID cases, most European countries are battling a big surge. From the UK to Germany, countries have reimposed restrictions, including a national lockdown in the UK. The United States, too, is struggling in the battle against the virus with fresh new spikes in numbers.
Over 76,000 deaths since the onset of coronavirus pandemic. Nearly 61,000 infections in a day, the highest ever for the United Kingdom. The island nation is now under strict lockdown, the third one so far. The country, which has started a vaccine drive, is struggling to get a grip on the new strain of the virus that is 70% more transmissible.
It's clear that we need to do more together to bring this new variant under control while our vaccines are rolled out. In England, we must therefore go into a national lockdown which is tough enough to contain this variant. That means the government is once again instructing you to stay at home.
The British Prime Minister described the coming days as the hardest yet, while imposing the toughest lockdown in the United Kingdom. All schools and colleges are shut. Citizens can leave their homes only for emergency purposes. Restaurants can deliver food but not alcohol. Only 6 people are allowed at weddings. Outdoor exercise allowed only once per day. Outdoor sports venues are shut, but events like English Premier League are allowed. The lockdown is backed by the Labour Party, which is otherwise critical of the government's role in controlling the pandemic.
At this darkest of moments, we need a new national effort to rekindle the spirit of last March, to come together and to do everything possible. So Labour will support this lockdown. We will vote for it in Parliament. We will join in this national effort.
I'm by the Oxford Street station and you can see only essential stuff is open here. Let me take you around and show you all these shops that would be normally buzzing with sales and people actually are shut down. This entire crossroad has a series of wonderful shops and restaurants. All of this is absolutely shut down.
The situation is no different in Germany. Confirmed cases in the country have crossed 1.8 million. Over 37,000 have died so far. Germany has imposed stricter norms till January 31st. Non-essential shops are shut. Restaurants, bars and entertainment venues are closed. Social gatherings are limited to 5 people over the age of 14. Movement of citizens is limited to 15 kilometers in areas having more than 200 cases per 1 lakh residents in 7 days. Apart from Europe, United States is also struggling in battling the virus, as the US reported as many as 3,900 COVID deaths in 24 hours, a new record on Tuesday. Globally, COVID-19 cases have surpassed 86 million mark with more than 1.8 million deaths. Bureau Report, India Today.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.